Mm. Hello and good evening, and thank you so much for joining us this evening. And welcome to the Suspension and Expulsion Prevention Rulemaking Advisory Committee. Today's focus will be on certified family childcare homes, registered family childcare homes, and then also the Early Childhood Suspension and Expulsion Prevention Program. So just a few housekeeping items while we're here. Please, while we are beginning, and I ask our DELC peers to introduce themselves, please put your name, the city where you are joining us, and your connection to this work in the chat. This helps us know who's on today and also helps us take attendance for reimbursement purposes. Also, this RAC meeting will be held in webinar format, so folks that have signed up to watch can do so, but you do not have to be on camera to participate in this meeting. Instructions for renaming your participant icon are being put in the chat. Thank you, Al, if you need to do so. I'm going to just quickly take a moment to introduce myself and my peers that are here with us tonight. My name is Abby Strom, and I am a child care initiatives analyst with the licensing division, and I'll pass it over to Allison.
Hey everyone, I'm Allison Delory. My pronouns are she, her. I am the child care labor liaison here at DELC, and tonight I'm just taking notes. So if I have serious notes face, that's why. Nice to be
Okay,
here with you all.
thanks. Eric?
Yeah, thank you. Hi, all. My name is Eric Hirschman. I use he, him pronouns. I'm also a childcare initiatives analyst with our licensing division.
Katrina?
Good evening, everyone. I am Katrina Miller, she, her pronouns, infant and early childhood mental health specialist with DELC.
Thank you. Cynthia?
Good evening. My name is Cynthia Smith, and I am a regional manager for the Portland East team, and I will be monitoring the chat this evening.
Thank you. And Kathy?
Hi, everyone. My name's Kathy Way, she and her pronouns, and I'm the rules and legislative coordinator here at DELC, and just primarily listening in and just supporting Abby and her team. Thanks.
Thanks. Thank you, Kathy. All right, and thanks so much for putting your name and information in the chat. We do appreciate it. All right. So quickly, I'm just going to go over our agenda today. We will start with what a rulemaking advisory committee is, followed by reviewing the scope and focus of this RAC. We will share some group norms that will serve as guideposts for our discussion today. And we will briefly review the pieces of legislation that have led to the development of these rules, and then also discuss the early engagement and policy concepts that were used as the foundation for the rules that you will see presented today. The majority of our time together will be spent reviewing the proposed rule text. We'll take about a 5-minute break, about 60 minutes into the meeting, and then we will conclude the meeting with ways that you can provide additional feedback beyond this meeting, and then additional steps in the rulemaking process. Okay. So what is a RAC? A rulemaking advisory committee is a group of internal and external partners, just like you, who have come together to help implement rules. RAC members provide valuable input and suggestions for rulemaking while considering the equity and fiscal impacts of the rules that are proposed for adoption. And then DELC really seeks a diverse group of individuals that interact with the agency and the programs run by the agency. So you will see childcare providers on this RAC, representatives from the childcare resource and referral and early learning hubs, tribal nation representatives, and union and advocate represented within this group. And most importantly, we also have parents and family members of young children. So the focus and scope of this RAC, we're hoping that you will help us identify if there are any impacts, unclear rule language, or any resources that DELC could provide to support the implementation of these new rules. We ask that you consider if there are any fiscal impacts associated with these rules, meaning will there be any monetary cost to implement the rule, whether that's the purchasing of supplies, additional staffing costs, or other costs to compliance. We ask that you look for equity impacts. So are there any unintended consequences of the rule that may impact specific populations? And we would like your help to identify any of the rule language that is unclear or that or or if you might not know or it's not clear how the rule can be implemented as it's written. And then sometimes when we make a new rule, it may impact other rules, and there may be unintended consequences to the way his rule is written or there might be unintended consequences in the way the rule is written that we may need to reconsider because of its impact on other rules within each rule set. And then finally, if you could help us identify any resources or supports that you think providers might need to implement the new regulation, just let us know. This could be technical assistance documents or templates or any other resources that you think would be useful to providers. So just briefly want to go over some group norms that will help guide us throughout our time together and really ground us in the work that we'll be focusing on. So allow opportunities for all voices to be heard. What this means is take space and make space. So maybe you've had the opportunity to speak or share your thoughts, and we haven't heard from others in the group. So maybe you just want to hold back and let others respond before responding again. Remain focused on the scope of this RAC, which we discussed on a previous slide. So looking for those fiscal and equity impacts, any unclear rule language. If there are questions about how implementation will work, we may jot those down and follow up with you at a later date. And be open to respectful discussion. So have an open mind and ask clarifying questions that might help you confirm understanding. We encourage and honor all individual perspectives and truths. All experiences are valuable and contribute to our shared understanding. We ask that you use the raise hand function or enter thoughts in the chat for comments. And just a note too, that all the comments in the chat will be read aloud for transparency. So the folks that are watching this RAC meeting can hear the comments that are written in the chat because they cannot read the chat themselves. And then practice active listening. We listen to understand and give time to reflect before responding. And then finally, seek commonality. We may disagree, which is okay, but we will be guided by our shared commitment to this work. So we wanted to share a little bit about the background as to how we came to these rules. So and several of you may know this, but in 2021, the Oregon legislature passed 2 laws that related to suspension and expulsion in early childhood programs. These laws were created in response to ongoing concern that children of color and children with disabilities are removed from care at higher rates than their peers. House Bill 2166, which we commonly refer to as the prevention law, created the Suspension and Expulsion Prevention Program, now known as Every Child Belongs. And this law also requires that licensed or publicly funded early learning programs contact Every Child Belongs when a young child is facing potential expulsion. This also gave the Early Learning Council, which is our governing body, the authority to adopt rules related to suspension and expulsion prevention. And the rules that you will see today are directly related to this bill. Senate Bill 236, which was also passed in 2021, prohibits the suspension and expulsion in early childhood care and education programs that are either licensed by DELC or receiving public funding through DELC. The prohibition takes effect on July 1 of 2026. And just a note, as noted in earlier communication regarding this RAC, though this law does exist, DELC does not have the regulatory authority to enforce the statute on behalf of families or take action under current rules for violation of this law. Because of this, no rules that you will see today are proposed that prohibit the use of these practices within certified family or registered family childcare programs. And our focus will be on preventing these practices, as that is where DELC's regulatory authority lies. So questions about how this law may impact childcare programs or how programs may be in compliance with the law are outside of the scope of this RAC. So just a little bit of background about how these rules were developed. The development of these rules began with policy concepts or broad ideas about
Sorry.
what's, oops,
Hey, I'm
sorry.
sorry, Abby, to interrupt. I
Yeah.
raised my hand on
Oh, I'm
the
sorry.
presentation here. So can you go back a slide, please?
Sure.
So regarding the Senate bill, I know that you stated at this point in time, the way that the rules are worded, DELC does not have the power or authority to, I guess, penalize or punish providers in any way regarding the expulsion rules if they don't comply with those rules. But what's to say that rules won't be changed in the future to then allow DELC to punish providers if they have to make expulsions that are necessary for the betterment of either the provider or the children in their care?
So in order for DELC to have authority to enforce the prohibition, there would have to be a bill proposed that, and it would have to go through the Oregon legislature.
Okay. Okay, thank you.
Yeah, you're welcome.
Abby, can I add on to that it would need to go through the Oregon legislature, and then there would be another rulemaking advisory committee like this one to establish rules related to that law. So this rulemaking advisory committee is only related to House Bill 2166.
Thank you, Katrina.
Thank you.
Okay, great clarifying question. Thank you, Kira. Okay. So again, the development of these rules started with policy concepts or broad strategies about how we could prevent suspension and expulsion in childcare programs. Engagement on these policy concepts began in fall of 2025 with advocacy groups and community partners. 4 concepts emerged, which included communicating and collaborating with families, connecting with Every Child Belongs prevention services, creating program policies, and we also wanted to ensure that the new rules could work with and enhance already existing childcare rules. DELC worked closely with the Every Child Belongs Advisory Committee, whose members include childcare providers, early learning system partners like childcare resource and referral and early learning hubs, community leaders, parents of young children, and regional representation from across the state. There may be even several people on this RAC who have participated in the Every Child Belongs Advisory Committee. The advisory committee is dedicated to providing guidance and insight as the program works to ensure equitable access to safe, stable, and developmentally appropriate care for all children and eliminate the use of suspension and expulsion in early care and education programs. And we're a key partner in engagement around policy concepts. We also engaged with the Oregon Partners for Education Justice, which is a cross-cultural network of community-based organizations, culturally specific service providers, and education advocates committed to advancing high-quality, racially just, and community-centered public education system in Oregon. Both Oregon Partners for Education Justice and the Children's Institute were key advocacy groups that supported the original pieces of legislation. In addition, DELC consulted with the Child Care Provider Union, AFSCME, and AFSCME represents certified and registered family child care providers across Oregon. DELC has also invited the 9 federally recognized tribes to engage in formal consultation on these rules. Throughout the engagement sessions, we received valuable feedback on how the rules could be shaped, potential impacts to families and childcare providers, and what supports might be needed to implement new requirements. Those involved in the initial policy engagement will continue to receive updates as rules are developed and will be invited to participate in additional feedback opportunities. So we just want to thank the folks that we have worked with previously. Okay, we are now going to transition to reviewing the rule text. This is where that second screen comes in really handy. So if you have a copy, you may want to follow along with us. The rule changes are highlighted in yellow, and we will focus on we will be sharing the certified family childcare rules. And the rules for registered family childcare programs are identical with one exception. So the definitions are the same and many of the requirements are the same. But where there are differences, we will highlight those and show both the certified family rule language and the registered family rule language. Once we're done with the facility rule sets, we will transition to the proposed updates to definitions to the Every Child Belongs Suspension and Expulsion Prevention Program. All right. And I apologize. This is the one part that's kind of clunky for me. Okay. Oop. Okay, reshare my screen. There. Okay, hoping folks can see the.
Abby, there is a question in the chat that may be helpful to talk through before we launch in.
Sure.
Would you like to read it or do you want to?
You go ahead and read it.
All right. Rachel says, I'm noticing that the term unenforceable is a bit confusing from a provider perspective. When new requirements are included in licensing rules, providers often assume that failure to follow them could result in licensing violations or findings during monitoring. Could you clarify whether these requirements are intended to be enforceable through licensing, or if a future bill would be needed to establish that authority? It'd be really helpful to clearly distinguish what is required and how compliance will be assessed. And Akira says, I second that.
Yes. So Rachel, great question. The requirements that you see today will be enforceable through routine licensing or in the way that we enforce other rules for licensed childcare facilities. So in other communication that we put out, we are proposing to adopt these rules in June with an effective date of September. So we will use those summer months to develop resources and technical assistance documents and make sure that providers are aware of these rule changes so that they can work towards compliance when the rules go into effect in September. So it will be just the enforcement mechanism already exists because DELC has the authority to enforce rules for childcare facilities. So no bill will be needed, additional bill or piece of legislation will be needed to enforce the rules as they are written today. That's why there's no ban on suspension or expulsion in these rules. Annalise, I see you have your hand up.
Yeah, just real quick, I just want to put out there that don't forget, the union, if you are a registered family or certified childcare provider, you have access to meetings with DELC prior to, get hooked up, get engaged with the union, find out when those meetings are, and you can come and do Q&A and whatnot, and get a lot of information that way. So
Okay.
we're here to help.
Thank you, Annalise. All right. I'm gonna make this. Oh. All right. The first definition we have is of every child belongs, which is, and oh, I do want to preface our conversation around definitions just by saying the definitions that are proposed are really intended to support the implementation of the requirements, which is what we will cover next. These definitions are not intended to interpret anything in the prohibition statute. So these definitions are really intended for prevention and the requirements related to prevention. Okay. Every Child Belongs is Oregon's early childhood suspension and expulsion prevention initiative. Every Child Belongs helps early childhood care and education programs keep children in care by offering timely, responsive support when challenges arise. Yes. Oh, I see in here that Annalise encourages the state to also define ECBC, which is Every Child Belongs Connect, which is the mechanism in which providers can request services. So thank you for that suggestion, Annalise. Kira.
Here we go. Sorry, took me a second to find the buttons. So, my question pertains to clarifying what timely means exactly. Like, how long can we expect to wait before we get support following our contact with ECB?
That's a great question, and that's we've received that at our last RAC as well. And these rules are not about the service delivery. But Katrina, I don't know if you want to come off mute and speak to service delivery from Every Child Belongs. So Katrina, if you'd like to come off mute and speak to that, though, you can.
Sure. Yeah. So keep in mind that this is just about defining the program as, or the initiative as, that the program is provides timely services. The expectation for grantees, this regional service providers, is to respond when a request comes in, to respond within 1 to 2 business days.
Okay, thank you.
Yeah. Thank you, Katrina. Okay. The next definition is expulsion, or someone else, Alicia.
Okay,
Yeah. Oh, I'm upside down. I don't know why I'm upside down. But I apparently I am. Let's see. Well, just go off camera. Um, so I'm curious. I was at the last rack, but I didn't bring this up at that time. When I see the ECB is defined as an initiative, but then at the same time is who is going to be contacted and kind of followed up with, like, it doesn't feel as if this is, I'm trying to understand, is Every Child Belongs considered an agency? Who is the one that's doing that work when it comes to having a timely response? Because when I think of initiative, I think of, right, kind of the policy or the idea behind everything. And then I'm hearing that Every Child Belongs is going to do something. So I'm just kind of trying to clarify that.
Yeah, that's a great question, Alicia. So we're using the term initiative because there's more than one type of program that is responding. So some responses come from the child care resource and referral agencies, programs, and some responses come from what we call regional service providers, which are the organizations, the grantees that hire the infant and early childhood mental health consultants. In some cases, they are the same organization, and in some cases, they are different organizations. It depends on the region. But it is those service providers.
Question go.
And just as a follow-up, is there any way that would be or place within the definitions that could be clarified? Just as, again, I hear this kind of verbal kind of clarification and confirmation of what it is, but within statute, I'm just curious about like how that could be laid out a little bit more clearly.
Well, Alicia, we can definitely take that feedback back for more. And if I'm hearing you correctly, just more or further clarification on every child belongs and potentially what services or who would respond to requests. What services are provided and who responds to requests.
Yeah, I guess overall, when I'm thinking of this as the definition, right? Is it as an initiative? There's an initiative, and then there's action that's being taken by someone, and it sounds like that is the same. Like they're called the same thing, but they don't do the same. Like the initiative is one thing, and then there's other people doing something, and so I'm just kind of I'm wondering if that could be a little more clearly laid out within the definition of every child belongs. And I'm sure there's more clarification within other parts of the OERs, but yeah.
And that to Annalise's suggestion of defining every ECB Connect, that might also help with that too. So, which is the mechanism to request supports. So,
Yeah.
both your comments we can definitely take back and look to see where we can make some changes.
Okay, thank you. I think that makes a lot of sense. Yeah.
Thank you. All right, the next definition is expulsion or expel means to permanently end a child's enrollment in a certified family childcare due to the child's ability, specialized needs, or behavior. Move us on. Annalise says in the chat that much appreciation for DELC for narrowly focusing the definition. The union believes that this is very well defined. No hands up. All right, the next definition is potential expulsion. And the reason we have defined or identified potential indicators of potential expulsion is because potential expulsion is the term that's used in the bill itself that we covered at the beginning. So potential expulsion is when a child care provider is required to contact every child belongs. But again, it is difficult to define what potential expulsion is. So we did just list some indicators of potential expulsion. So potential expulsion refers to the risk of a child being expelled permanently from a certified family childcare home or childcare. Indicators of potential expulsion include, but are not limited to, the use of strategies identified in the program's guidance and behavior policy. So that references the guidance and behavior rules without reducing or eliminating the challenging behavior. The use of a temporary safety-based intervention, which will be defined later. And then the use of physical restraint with a child on more than one occasion. And we have a section on physical restraint that we will also review. Okay, any feedback on potential expulsion? Brenda.
My question is just the wording in the certified family childcare. I'm a childcare resource and referral, and certified family, registered family and centers. Is this like only to certified family, or is that a word? Like, I guess I'm confused on who does this pertain to?
Sure, great question. And the rules we are looking at today are written specifically for certified family, but this definition exists in certified center, registered family and outdoor nature-based programs. So the rules across all those license types that I just listed are almost identical, except with the facility name change. So in registered family, this says, you know, permanently or expelled permanently from the registered family childcare home, or the outdoor nature-based program.
So we are looking at the certified family rule book right
We-
now. It's what it would, but it would be across the
Correct.
board of it. Okay, thank you. That
Correct.
clarifies
Yep.
it. Thank you. Sorry about that.
So Kelly asks in the chat, do these rules still apply if the child has an active IFSP with goals related to social emotional supports? The rules apply to all child care providers, and so would apply to all children in care. Thank you, though, Kelly, for the question. We do have rules on plan of care for specific children, though, that might address some of that as well. So, okay, I'm going to move us down. So, serious safety threat refers to a child's behavior that presents a danger to the physical safety of themselves or others, which cannot be reduced or eliminated by the program's existing guidance and behavior strategies. So, and again, we will see this term used later in the requirements. And when we get to those part of the requirements, one of my peers will also cut and paste this definition into the chat so you can see how it's used within the requirements. So, Kira.
Oh, not muted. Okay. I think for that definition, I mean, I would highly recommend that the word immediately is in there so that it reads that the physical safety of themselves or others, which cannot be or cannot immediately be reduced or eliminated utilizing the existing guidance and behavior policies or strategies. Sorry. Because if it's a serious safety threat, it is something that needs to be immediately reduced or eliminated. It's not something that might take a few days to address.
Thank you.
And Abby, we had another comment in the chat from Laura. How did you determine that?
How did we determine?
I'm assuming, and Laura, please come off mute if you'd like to clarify your comment.
Absolutely. I guess because it says the definition, it says which can be reduced or eliminated by, or which cannot be reduced or eliminated by the program's existing guidance and behavior strategies. I guess when you think about like what strategies are in place, like how do you determine that? Because there's different educational philosophies then use tier 1 supports and use things like that. So how do you determine, is it self-reported by the program or is it somebody coming out? I guess that's kind of loose if I'm thinking about it in terms of like how like our organization CCRNR supports programs. So like we would offer TA and stuff like that. And sometimes there's like tier 1 supports that can help prevent some of this. So I guess how do you determine that?
So the programs responsible for developing their own guidance and behavior strategies. There are some of those that are outlined in rule already that must be incorporated implemented in the child care program. But it is, so that would be the program's existing guidance and behavior strategies. We don't have any specific sort of, we don't require the pyramid model or conscious discipline. So there's no specific group of strategies beyond what's written in rule. So the program would be required to try to mitigate the behavior using existing, whatever they have written in their guidance and behavior policy. And the behavior would not be able to be reduced by using those strategies in order for it to be considered a serious safety threat. So that's how that would be determined. Alicia?
I'm curious about, and this is kind of outside of this specific definition, but I'm just curious about the program, like the guidance and behavior strategies that are developed by each program. Is there any guidance and is there any oversight as to what those strategies and programs are um, uh, that entail, like what they have? Because um, the way it's written as of now, it feels as though a program can just decide, here's what we're going to do. And if that doesn't work, we can go and follow these guidelines and proceed with suspension or expulsion, etc. And those existing guidance and behavior strategies may or may not include evidence-based strategies or programs and possibilities that are that are known to be effective. And so I'm just really curious about where the guidance is coming from around creating those programs, guidance, and strategies.
So, Alicia, and I want to be able to move us along too. So, in terms of implementation of a guidance and behavior policy, there are strategies that are outlined in rule. There are also prohibited activities that are outlined in rule too, so that could not be used and cannot be used by a childcare program. We also have a lot of technical assistance documents. We refer them to Laura in the Child Care Resource and Referral if they need help developing guidance and behavior policies and implementing those in their child care program. But what is required to be in there is outlined in rule. And I don't think that that section is covered today. But I do hear kind of the request to include like evidence-based best practice in this definition.
Yes, and I'm again, I see that there's an OER here, and I don't know if it's guiding it towards directly what that rule is, but if we could at least have that as a part of the definition as well, to make sure that the rules are embedded within that definition. That's what I mean.
Thank you.
Yeah.
Thank you, Alicia. And I know that there is some also questions or comments in the chat, which just Annalise says that the union does not agree with the addition of the word immediately, and that she's guessing that DOJ attorneys would also not agree. Rachel says, yes, this feels open to interpretation. Could you clarify who determines when the indicators are met and would result in a licensing violation? So this isn't a requirement yet. This is just a definition. So Rachel, let's see if some of those answers, when we get down to the requirements, if that question still exists. And then Kira mentions that it feels open to interpretation, and there are also a lot of subjective concepts. And the union supports current proposed language from Annalise. Okay, I'm going to move us along. Okay, suspension means reduction in the amount of time a young child may be. Oh, do we have another one?
Sorry, yeah, I raised.
Okay, Kara. Sorry. Go ahead.
No. So, along with the serious safety threat, I also had another suggestion for an addition pop up. I would suggest adding specification to clarify that the others that are in this definition would be considered people who are in the program as well as people interacting with the program.
Okay.
And then in regards to registered family, a lot of people have family pets. So I don't know if that is something that could be incorporated to be included in that definition as well.
Thank you, Kara. Okay. So suspension means reductions in the amount of time a young child may be in attendance of a certified family child care, such as requiring the child to cease attendance for a temporary period of time, except if in connection with the temporary safety-based interventions as defined in these rules, or reducing the number of days or hours that the child may attend due to the child's ability, specialized need, or behavior.
We did have a question in the chat, but it was for Annalise. Didn't know if Annalise wanted to speak more.
Oh,
Sure. Just very briefly, I've been in administrative hearings and litigating on behalf of childcare providers as a lay representative for more than 20 years now. And the way that these rules get applied, my understanding of how the system works within the rule sets and what you need to do for, say, a findings review or fighting an action in front of an administrative law judge. I appreciate everybody's comments, but I approach this literally from a enforcement due process stance or perspective. And so without going, I mean, I could talk about this for 2 hours. I don't want to do that. So when you have rules that are written very generically, DOJ has already reviewed these. We've been through these a couple of times with Delk already as well. It just becomes this issue of not bogging the rule down so that we can win a hearing if we need to based on for a childcare provider.
thank you. Kira, do you still have your hand up? I'm going to ask us that we stay focused on reviewing the definitions and reminding folks of the purpose and scope of the RAC. And Annalise, I appreciate your comments and answering that question. So Kira?
Yeah, so regarding the definitions of suspension and temporary safety-based intervention, it took me a long time to understand that the definition is intending for these concepts to be separate things. When I first read it, and for probably the first 30 minutes of me pondering on it, it sounded like it was just a phrase that was reinventing the wheel. So, if there's just any way to more greatly differentiate those two definitions, I think that would be a very good thing to do. Just to make it more clear that suspension is a temporary ban from childcare programs due to pretty much any reason that could be considered. Whereas like the temporary safety-based intervention specifically pertains to suspension due to a serious safety threat. I think that it needs to be underlined more so that people understand it better.
Thank you, Kara. Okay, so and in connection to Kira's feedback, the next definition is temporary safety-based intervention, which is temporarily removing a young child from a certified family childcare when the child's behavior poses a serious safety threat as defined in these rules for such a period of time and for no longer than necessary to incorporate supports to reduce the occurrence of the behavior, ensure child safety, and have the child return to the program as quickly as possible. So, and Annalise says, we had in previous meeting encouraged program determined, adding program determined in front of reductions for 51. And that's to, I believe, that the program is determining to make those reductions versus like a parent who may make the choice to reduce a child's time in care, or it's recommended by consultation with a specialist. So thank you, Annalise. Okay. All right. And finally, we are defining young child as any child who is 6 weeks of age until eligible to enroll in kindergarten on or before the first day of the current school year. The reasons for defining young child is the term that is used in the law. And programs are required to contact every child belongs when a young child is facing potential expulsion. So this would mean infants through preschool. And then this definition aligns with how we statutorily defined school-age child. So school-age children are not included anytime it says young child. The requirements say young child. Okay. All right, seeing no additional comments or hands up, I'm going to now transition us to the actual requirements. And again, we will see Al will graciously pop in definitions that are related to the words that we are, or related to the requirements we're discussing. So the First Amendment comes to this section under policies, and the lead into this rule says that the provider must have written information and policies identified in this section below and provide them to caregivers and also for parents at the time of a child's enrollment and also when they change. So the additional policy that must be created and then given to caregivers and parents is the suspension and expulsion prevention policy. So this rule just requires that child care programs also give out their suspension and expulsion prevention policy. Any feedback on this specific rule? We'll provide a fillable template for the policy. Rachel, that is definitely on our radar. Is developing some sort of template based on what the rules require, which we will be reviewing here shortly. Thank you, though, for that suggestion. We've heard that would be really helpful for providers as they're working through this. Annalise.
Yeah, I was just going to ask if there was going to be like guidance documents and so on. And of course, our union will also develop some, so and put on our website. That might look a little different, but yeah, I think it'll be great to have resources.
Hi, Kira. You're on mute, Kira.
Sorry.
All right.
I'm getting a little
okay.
bit lost here on what section we're on.
Sure.
Are we on definition 4 or?
We're in section 200, which is policies. We've moved on from.
I'm on there.
Yep.
Policies. So 0200. Are we going through each individual line
We're
item?
not. I'm only covering the yellow sections, the additions.
Okay. So if we have questions about clarification on any other items in this
Those are.
policy, we'll need to ask someone about that another time.
I would say that's probably outside of the scope of this RAC,
Okay.
but we can. I would recommend that you speak to your licensing specialist if you have questions about any of the existing requirements that we're not going to cover today.
Okay.
And your licensing team would happily help you with that.
Thank you. Thank you. Yeah, thank you. Just wanted to clarify.
Not a problem. There's a lot of rules in here and a lot of editing marks, so it's easy to get lost in here. Okay. So section 4 under here is we have just added, this is about completing an individual assessment of a child known to have specific needs. And we have modified the beginning of this rule and then also added the requirement that if a child care program goes through this process, conducting an individual assessment for a child, that they must also comply with the suspension and expulsion prevention policy rule requirements. Okay, Kira?
Hi, yeah, thank you. So, regarding the topic of known specific needs, maybe this has more to do with implementation of the program, but my concern is that a child may not necessarily be known to have a specific need. For instance, I watch newborns and I have children who are growing, who I started as newborns, they're growing into toddlerhood. If they suddenly develop specialized needs down the road that I'm not equipped to handle, how would that be addressed? How does that fall into place with this ruling? And then my other example would be like if a parent is trying to keep hush hush because they're concerned that they're just trying to find placement for their child. What if that information is withheld from the provider and the provider it's masked enough that the provider during assessment does not see this as a potential extra need that is required of them? What would protect the provider in that case? Like I guess is there any sort of protection there? The way that this is worded, it doesn't seem like it's descriptive enough to consider that.
So is your suggestion that we better define what known is? Or
I
one
think
question we
that
had was
how
about
it
known by
might,
whom. Yeah.
yeah, by known by whom and how that information may be brought forth to the provider and whether the provider has the opportunity then after their initial assessment, after caring for the child, to then take their observations and reconsider having that child in their program.
So the rule requires in this section that there is an assessment that's completed that involves these four elements. And I do want to just state that there is the prohibition, um, you know, prohibits the use of suspension and expulsion in childcare programs. Um, Even though our rules do not have that, um, or do not require that, there is a law that does. And you may want to consult with any sort of, legal authority that you may, or not legal authority, but you may want to seek legal guidance on how that law may impact you. This this rule in particular is about conducting an assessment for a child. And by known, I think it's whether that's, and we could provide more clarity, but just like known meaning it might be known to the provider, it might be known to the parent, it might be known through observation in your program. But there's definitely a need for, it sounds like you would like us to be more specific about that.
Yeah, I would, but also is this assessment taking place before or after the child has started care with the provider? Like, can this happen anytime? Can it be reassessed?
The rule does not define when this happens.
Okay, so it can happen at any time.
It just says
And
it has to be
as often as,
known to have specific needs.
okay. So when it becomes known that a child has specific needs, maybe that's how it should be written then. When it becomes known that the child
Okay.
has specific needs that is required to fully be integrated into the program, then the provider has the opportunity and needs to assess whether they can provide that care. Does that sound
Your
like it would
suggestion,
work?
yeah,
I
your
mean,
suggestion is that is or I'm sorry, I'm sure Al caught it, but and there are other folks in the chat, or there are some other folks in the chat, but your suggestion is that we add when it becomes known that a
yes,
child has specific needs. Yes.
yes.
Okay.
And becomes known to the provider.
Yeah. Yeah. And some of your questions are also about implementation. So
Yeah,
I want
and
us
I get that.
yeah,
I get that, but I do think some of that does need to be included in the definition.
or in the rule. So just
It-
about
Yeah,
known to be, yes, because we can only hold providers accountable to what is in rule. So anything that is outside of this rule is not necessarily something we can hold providers accountable to. So your suggestion is that we add a few words around when it is known or when it
Mhm.
becomes known. Okay.
Yeah, yeah. I think
Okay.
that
I'm
would definitely
gonna
help.
read the notes in the chat. Rachel said, could you clarify what documentation will be required to demonstrate compliance with the assessment requirement? Again, whether templates or guidance are provided. I'm also wondering whether all providers are expected to have the skills to conduct these assessments, or if DELC will recommend or provide guidance on specific assessment tools. There is no documentation requirement specific to this rule, but we will take that feedback back. And there would be templates available for providers to use this. Okay, and Corey says, will there be a standard assessment used or guidance on specific assessments? We answered that question. Review the child as they review the child's needs to ensure the child's aren't screened out of programs before having a chance to enter the setting. I do want to also mention that we do have a rule that requires programs to be compliant with ADA. So there is that requirement existing. So Rachel says, depending on the assessment tool, I would flag this is an area of potential fiscal impact as well. Okay, note that. I'm concerned that the assessment prior to the admission would not comply with ADA. I have a concern, same concern as Rachel. And then Al's captured it in the notes, and a provider must, a child the provider knows to have. So a provider must complete an assessment on an individual child. Annalise, I might have you, not fully understanding your comment. ADA requires individual
Annalise,
assessments
I
prior, not
think that
to
makes a lot
non-religious.
of sense.
Yeah, so what I guess what I would, if I was DELC and I wanted to address the concerns, I would say a provider must complete an individual assessment of a child. You can say known to the provider, or when a provider knows, or a child the provider knows to have specific needs. Just a couple of words will clarify
Okay.
that for child care providers. And if
All right.
people here are asking about it, then it's going to be a problem, right?
Yeah. Thank you, Annalise, for clarifying that. Appreciate it. All right.
I'm sorry, now that with that being stated, then it makes me a little concerned around how does the provider know this, right? Like what has to be disclosed beforehand for a provider to know this information, and therefore that would probably be coming from the family, and the family has their own rights to disclosure. So ADA, I don't know why ADA would require parents to disclose everything, at least. I think it would be dependent on what what we're talking about. So they may have specific needs, but I'm just trying to understand what in the comments what they mean by the parents are required to disclose. I don't. Yeah. But again, as parents are coming into childcare facilities, families are coming into childcare facilities, the amount of information that's required of them to disclose is, up to that family. So I'm just curious about when we're saying that the provider knows this ahead of time, how are they getting that information?
So we do have rules regarding information that is included in a child's file or enrollment paperwork. I don't believe, I would have to go back and double check, that I think there's really some general statements around how to support the child while in care. And if there is anything, so I'd have to go back and check. But that is all that DELC may require, is what's in rule. All right, we are actually I'm going to leave this last comment and then I'm going to have us take a break because it's 7 o'clock. And Rachel asked, I'm wondering how DELC is thinking about the use of universal screening as an alternative to signaling out individual children for assessment. It seems like that approach could support equity and reduce bias. Could you also clarify whether parent consent is required for the assessments under this rule and how providers should proceed if the parent declines? Okay. So consent is required. So this is, it does say in here that the assessment must be completed with the family or the parents. And the assessment, I just want to say too that this is really not there's a lot of questions around this rule and we've got a lot of feedback about it today. So I think before I answer any additional questions, because you've proposed a lot of changes, we just might have to go back and look more at this rule and how we can address some of the considerations that you have brought forth today. So I might not have all the answers today for this rule. All right, it is 7:02. We're going to take a 5-minute break. So if folks could come back at 7:07, we will pick back up. Hello, everyone, and welcome back. I'm going to keep us moving right along. So, our next section, there is one comment in the chat, and Annalise says that the ADA and these rules would only apply if the family divulges the specific or special need. If they aren't sharing, then the rules don't apply to the provider because the provider doesn't know. Okay. The next section, here says, thank you. The next section is in regards to the items that need to be available for review. And the item that's been added is the suspension and expulsion prevention policy. So I think this is under section 3, the provider must have the following items available in a prominent and frequently visited location for parents and the public to view. And so the suspension and expulsion prevention policy has been added to the list of those items. And as a reminder, this is under the list of things that do not need to be posted, but do need to be just available for folks to review. Any feedback on this? Okay. All right, that one's pretty easy. Okay, the next section is on notifications. So this rule has been amended to add requirements about who the program must notify when they are implementing a temporary safety-based intervention, and also about notifications to parents about that as well. So a provider must notify CCLD by 5 p.m. the next business day of the following items. And the item that's been added is the implementation of a temporary safety-based intervention. Yes. And Al, thank you for dropping in the definition. The next requirement under notifications is that a provider must immediately notify parents or an emergency contact if the parent can't be reached, and document if their child exhibits behavior that requires the use of a temporary safety-based intervention. So the provider is notifying families immediately if the child's behavior requires the use of a temporary safety-based intervention. Any feedback on new notifications, either to CCLD or families?
Nothing in the chat so far.
Okay. Oops, this is a change only to reference number. Every time we change definitions, things reorder. So anytime there is references to a definition, then we have to change that rule to update the number. So the next section is on physical restraint. And this rule is being amended to require that the child care provider contact every child belongs when physical restraint is used more than once with a child. This is because it is considered, like we defined earlier, a indicator of potential expulsion. So if the provider has not previously done so, the provider must contact every child belongs if physical restraint is used more than once on a specific child. Yes, Kira.
Would this follow suit with the other guidelines that you should be contacting ECB by 5 p.m. the following business day?
We would ask that you contact every child belongs when you can. There's no timeline that says you have to contact them by 5 p.m. the next business day on this, although that is a interesting suggestion that we might consider. Would you recommend that there be a timeline on that? Or the other timelines are about notifying CCLD if you're implementing a temporary safety-based intervention.
It's all kind of along the same lines, I think. I think there should be a time limit. I mean, in the interest of transparency, I think it is something that there should be a time limit on.
Thank you, Kara. And Alicia?
I as we're talking about this more, I'm recognizing that I think it would be helpful to have a timeline, but it just is important to recognize, like, if there's all of these other interventions that they're required to inform every child belongs about within a certain amount of time, and this is one that is not, which is a very important one. So I think that it's important that if a child has to be physically restrained more than once, they're probably being put on a temporary, what's it called again? Temporary safety-based intervention, which is going to require them to reach out to ECB anyway, but I think it should be laid out in this rule as well.
So it sounds like the suggestion would be that there is some sort of time-bound requirement to contact Every Child Belongs if there is a um, indicator of potential expulsion. I think that's what I'm hearing. Okay. Thank you.
Yes, but I think
Oh,
I
go ahead.
think specifically for restraint, for physical restraint, it needs to be laid out because
Okay.
that's a very high level of intervention.
Mm.
And if that's happening, there should be some type of reporting of that and intervention and support and TA around that type of intervention, you know, as soon as possible. So I think that it needs to be laid out within that particular rule.
Thank
I
you,
agree that
Alicia.
there should be some urgency with that.
I think too, I want to bring this up, that it is required that they contact the parents if physical restraint is used, and we could align it with that timeline. So I will definitely take that back to the group too. And then Kelly says, Katrina, as a consultant, I'm wondering more and more how how well us or how well we as consultants need to be versed in more of these requirements and language. It could affect how we triage and deliver services. Sounds like you and Kelly may need to have a discussion outside of this meeting around that.
Yes, I think so. And good call out, Kelly.
Okay. Rachel asked, could we clarify what more than once means here? Rather, whether there is a defined time frame. Could you speak to how this requirement may impact the volume of referrals to Every Child Belongs? I'm wondering whether this could result in a significant increase in requests or how capacity is being considered. I probably can't speak to how it may impact the volume of referrals. More than once is more than once. So if it's used twice on the same child, you would be required to call. There is no, currently in rule, there is no like, if it happened once in June and once in November, so there's no time frame on those occurrences. But it would mean if it happened, you know, a second time with one child. There are also other requirements within this as well. So if physical restraint is used more than once on a specific child, the provider must, like, there's a lot of follow-up that has to happen for some of the exact reasons that Alicia mentioned and Kira mentioned. Like, it is a very intense intervention. So there are a lot of other factors and other requirements if it does happen more than once. And ECB is not the only option, or not the only step a provider has to take. I have concerns about services and influx of requests may not anticipate. Yes, those are about service. Some questions about service level in and requests that may come into Every Child Belongs. Yep. And then Rachel says some children are in care for 3 to 4 years. Yes, go.
Abby, can I speak to the capacity concern?
Yes.
And
Sure.
I would say on an implementation level, we're always thinking about capacity. And this process is really thinking about what does DELC need to do, what do providers need to do to be in compliance with the law. And so it is, this process is really focused on clarifying those, what does it mean to be in compliance? And then the implementation will, is a separate conversation around how will we manage capacity, and what will capacity look like. But I understand questions about capacity.
Thank you, Katrina. Okay, so the next section that we're going to cover is what are the requirements for the policy themselves. This entire section is new. And we'll walk through it and then pause for any feedback after we kind of move to a different requirement. So first, the provider must develop and implement a suspension and expulsion prevention policy. And then the prevention policy must be consistent with the provider's guidance and behavior policies, so it aligns and connects with what they're already required to be doing. And then it needs to identify existing supports or tools that may be accessed. So some programs may use the ASQ or may use some sort of developmental screening tool already. So we're asking that they identify them. And if they don't, then that's okay too. And then Kara says, behaviors should read as behaviors. Behavior should read as behaviors. Okay, thank you. In 3A. Oh, and then I'm sorry, I lost my place. C, if there are additional caregivers, so if a certified family provider has additional caregivers, the provider needs to identify when and how those caregivers must seek support when challenges related to the care of children arise, including when and in what circumstances caregivers must seek support, how the provider will respond to requests for support from other caregivers, and what program level supports may be made available to caregivers. So, and Rachel still is wondering, it might be helpful to clarify the time frame for more than once. Okay, for children who may be in care for several years, more than once over a full period of time is very different from more than once in a short time frame. Thank you, Rachel. Yes, we can take that back to the group and see if we want to add a time for use of physical restraint. Okay. Any feedback on the prevention policy? So specific, this is the part that's slightly different for registered families, so I do want to pull this up. So, oh, Kira? And you're on mute, Kira.
Dang it. Sorry, guys.
Okay.
Thank you. So I have notes written how I think certain things should be written so that it's more clear. Can I just pile these up in the chat here for you guys? Or would it
Sure.
be clear if I orally walk through it with you?
Well, I'm going to ask probably that you put them in the chat because
Okay.
I want to make sure we are able to cover all the sections and then and leave time, of course, for Katrina to go over.
Yeah.
Thanks.
Okay. Thank you.
And then yes, Al, we copy over everything that gets placed in the chat. So we definitely we review all the chat comments as well as those stated verbally.
Great.
So,
okay.
yeah.
Thank you.
Yeah, you're welcome. So I want to drop down to the registered family suspension expulsion prevention policy. And note that it does not include the section around other caregivers because currently the way that registered family rules are written, there are no additional caregivers except for substitute providers. And substitute providers also must receive an orientation around the program's policies and procedures, which that would be covered in. But that is the difference between this section for registered family and certified family is the part about caregivers and having to notify folks. This got small all of a sudden. Whoops, there we go. So I just did want to draw that out. So the policy must also identify how the provider will determine if additional supports are needed for the child, and identify when the provider will request services from Every Child Belongs. This is if different than what is already required. So they're required to contact Every Child Belongs when facing potential expulsion, a young child. But the provider may identify that they want to request services earlier. This was also something we heard in early engagement as well. is trying to contact services earlier rather than when a child is facing potential expulsion. And then the final part of the policy is that it must include the method that the provider will use to notify a family of concerns related to the child's ability, behavior, and development, such as written notification or an in-person conference. So this allows the provider autonomy to make those kind of choices for themselves, their program, and the families within their program as to how to best communicate with them, whether that's in person, over the phone, conferences, things like that. And then Alicia.
I just want to note a slight issue with the word development and within this phrase, because I'm concerned that a provider may use a lack of development or being behind in development as a reason for suspension or expulsion when there may not be other behaviors. So I'm just a little concerned about that that term being used in there.
Okay. Yeah, because this does read slightly differently than the definitions we use of suspension and expulsion. I think you're
Exactly.
correct. Yeah. All
Yeah.
right. Alicia, thank you for that.
And as a parent of a child who was expelled for a lack of developing along the same pace as their peers, it's really disheartening when it's really just based on a lack of being able to make that development in a timely manner. So really kind of hits home. So
Thank you, Alicia. And Alicia, you also wrote in the chat that more than once over a few years still matters and should be reported. So I think this is reflecting back to physical restraint. Reporting this information does not mean that a violation has happened or that licensing is in jeopardy. I don't think that it should be delineated as the point is to provide support and TA for those behaviors, regardless of how far apart the behavior has taken place, and to make sure that the provider has the tools necessary to avoid further restraint. Physical restraint is traumatic experience, no matter how often it takes place. Thank you, Alicia. Laura.
I agree. It's really traumatic, and I think that's why going for support is super important ahead of time. I'm wondering if that should be referenced in that. I think that's where it's confusing because it just sounds like they're reporting to it, but it doesn't say why. So I'm wondering if you could add in like, as this is an early indicator of suspension and expulsion,
So
that it's
connecting it
clear
back.
for the
Yeah.
reader.
It's a good call out. Thank you, Laura. Okay. Kira has suggestions on 3B strategies and supports the provider uses to support the child and efficacy of the strategies. Yes. Strategies. Okay. All right. We're going to, so section 3 is about the potential expulsion. So when a young child is facing potential expulsion as defined in these rules, the provider must document the challenging behaviors and any known triggers. So for example, specific activities, times of the day, or transitions. And then document the strategies the provider used to support the child and their effectiveness. So what did you try and did it work or did it not work? And then request services from every child belongs. And simultaneously with the request for services, notify the family regarding the behavior concerns. So there are, when a young child is facing potential expulsion, documenting behaviors, documenting the strategies, requesting services from every child belongs, and then notifying the families through whatever method their policy says that they are notifying families. So when they're notifying families, the purposes are to begin to collaboratively problem solve, to identify strategies and supports for the child, and establish the frequency and method of ongoing communication with the family. So whatever works best for the provider and the family in terms of communicating about the behavior. Any feedback? We read Kira's feedback about 3B. Okay. So 4, if the provider is unable to connect with the child's family as outlined in the above rule, the provider must attempt alternative methods for communication and document those attempts. This was added at the request of from early engagement with childcare providers, specifically if there are families that may not be responsive to attempts to communicate with. Okay. Next, we're getting into the use of temporary safety-based intervention. So a provider may implement a temporary safety-based intervention if a child's behavior creates a serious safety threat as defined in these rules. And then 6 covers what happens when a temporary safety-based intervention is implemented.
Abby, we do have 2 more comments in the chat.
Okay, I'm also going to copy and paste this. Copy, thank you. Okay, so I think it would be, Kelly says, I think it would be helpful to state that the provider will notify the parents or guardians that ECB has been contacted to support their child. Okay, and Rachel says, taken together, this represents a significant administrative workload. Curious if it feels feasible to providers, especially when they're working alone. Rachel, think. Okay, and then Chelsea says, I think setting time limits for when documentation needs to happen and requests for services. For instance, if the provider reaches out to the family and it moved, sorry, and does not receive a response within 48 hours or whatever seems appropriate. So putting a time frame on that communication and when all alternative forms of communication should be used. Okay. So in this, Rachel, it seems like it's a lot and adds to administrative workload. And this is definitely a place where we could look to provide templates and resource documents for providers kind of to ensure that they are, well, to support in the development of policies, how to communicate with families, like really developing a kind of a practice toolkit for these things that may alleviate some of that workload. But we would also want to gauge too during implementation what this does add to providers in terms of time. Okay, I did want to throw this in the chat too. This is, and thanks to DELC folks for this. This is the, and we would share this at the end as well. This is the public feedback form as well. So public comment. So if you'd like to make public comments beyond this meeting, you can use this form to do so as well. And those would also get to us. They'd go to Kathy, and then Kathy would send them to us. Okay. So a provider, we're going to move on to temporary safety-based intervention. So a provider may only use a temporary safety-based intervention if there is behavior that meets the definition of serious safety threat. So back to that definition, the provider must document the behavior and the provider, there is behavior that meets the definition of serious safety threat. The provider must document the behavior, and the provider has attempted to address the behavior through strategies outlined in their guidance and behavior policy, strategies suggested by the family, and any recommendations from professionals previously consulted about the child. So a temporary safety-based intervention can only be used when there is behavior that is a serious safety threat, and the provider has attempted to address the behavior through strategies, their existing strategies, and then also any strategies suggested by the family. And if there has been contact with professionals about the child's behavior, that they are implementing those strategies as well. And Kara, you have a question about 10A? Oh, down there, down there?
Sorry,
Okay.
no, I accidentally hit enter before I answered the question. Yeah, no,
Okay.
I'm skipping ahead, so I'm just plugging these in because it takes me a while to type. So
It's okay. Sorry. Okay. So any suggestions on the use of the temporary safety-based intervention or when it can be used? Okay, so 7 is if what's required if a provider initiates a temporary safety-based intervention. The provider must contact Every Child Belongs immediately to request services if not already done so, and notify CCLD of a temporary safety-based intervention by 5 p.m. the next business day. So that ties back to our notification section. We did receive a request at the last RAC meeting to also add the parent notification piece in this as well, so that it's consistent between both the notifications in this section. So we will be recommending that we add the parent notification into this section as well. So Brenda.
I don't know. This is the very first time I've seen any of this, obviously, but my understanding of Every Child Belongs is not giving support to the individual child or about the individual child. It is going in and supporting the provider, giving them strategies for, because we're not supposed to target a child. It's supposed to be the provider, strategies, their environment, and that.
Mm-hmm.
I'm just concerned, like reading through this, it kind of sounds like we're targeting and like our provider's going to look at this like it's for just that child. Is this opening up a can of worms for confusion? That would be my concern. And maybe I'm way off, but I'm just wondering.
It's a really good, Brenda, question or comment. I think our intent is that providers are contacting ECB to get supports. And Katrina can speak more to the services that are provided. But I believe that your understanding, Brenda, is generally correct, right? That ECB is intended to be supports for the provider in working with children generally. But that may also, depending on the circumstances, may become child focused, Katrina, but that is just through infant and toddler mental health consultation. So,
yeah, that's right, Abby. So we know that it is individual children who get suspended or expelled. And so there is, when we are trying to prevent suspension and expulsion, there is a child that is the subject of whatever's going on. The ECB services, on the technical assistance side, it's always going to be working with the provider at that kind of classroom and program level. On the side of the infant and early childhood mental health consultation services, it will address classroom and program level concerns, and there's also the option for individual child level concerns. It's still not working directly with the child, like the infant early childhood mental health consultant would be working directly with the child, but with the provider to support the child. So you're right, and it's also there's room for it with infant and early childhood mental health consultation.
Yeah. I just wonder if that's going to be clear for our childcare providers, that they understand that and don't think it's child specific targeted. Would be a concern.
Thank you.
Thank you, Brenda. Laura?
Thank you, Brenda. I feel like I've been sitting with that kind of too, because it kind of sounds like with all the documentation without guidance on that, it kind of sounds like it is targeted at children, individual children, as opposed to like a system that's set up to support providers and being able to have universal strategies to support children.
Mm-hmm.
And I'm wondering if there's a way to like, I don't know if it's like explaining further about how they utilize documentation, but the way it reads, because it's so short and brief, it reads almost like it's like document on all these children. And we know that there's bias that exists. We know that Black boys are seen as older and or held more accountable than other children. The data shows that. And so I'm wondering how this might land and feel if we are doing that, and how that might land for families that are in these settings.
Thank you, Laura.
This is also helpful to separate out the licensing rules from the implementation of the services, and that we can talk more in the implementation of services about what the support looks like, about those universal supports, and the preventive practices. Yeah.
And I'll just refer back to the statute, because the statute requires when a young child is facing potential expulsion is when they're required to contact Every Child Belongs. But again, so we have to hold providers accountable to that standard, or to that timeline. But that doesn't mean that they can't contact earlier to receive services earlier. And I think that is definitely what is encouraged. Kira?
I think the reason it is feeling so targeted towards like an individual child is because if a child is on the verge of becoming suspended or expelled, that is such an individual basis, such an individual case. So I feel like the way that the supports are being, I guess, rolled out in these rulings, I don't think that there is a way to make it feel less targeted. That's just my take on it.
Thank you, Kara. So
Abby,
I'm
we've had
I'm
quite a
gonna
lot of comments
go
in the
into
chat,
the
yes.
chat. Yeah. Okay, Rachel says, could DELC provide more specific criteria or examples of what constitutes serious safety threat to support consistent interpretation across providers and licensors? Rachel, that's a good suggestion for either a technical assistance document or a rule guidance document. One of the other things that we've heard previously in engagement is really how do we differentiate or ensure that the behavior is developmentally appropriate. So really kind of outlining that in support documents for both providers and licensing specialists. Chelsea says, I think serious safety threat definition could be more clearly defined and what creates a serious safety threat. And then Kara says, concerned with the provider's responsibility to stay in touch with the family regarding the child's challenges and behavior. What if the parent is not collaborating with the provider? And what if the provider only occurs or what if the behavior only occurs in childcare? So, and I think that's in relation to 10 as well. I agree. Corey says, I agree with Rachel and Chelsea. Additionally, what is the definition of physical safety? I know that the K-12 system defines physical injury. It is a scratch. Oh, interesting. We may need to look, we could reference maybe, or look to reference some other definitions of physical safety and physical injury. Kelly says, as a mental health consultant, please reach out sooner rather than later for support. So an encouragement to reach out sooner. And Rachel says, I agree. I think families need to be aware that providers are required to report this to ECB, because what if parents do not want ECB to come into the program and watch their child? And I think Katrina kind of referenced this, but contacting ECB may result in several different layers of support. And I think that anything involving an individual child would require consent from the family.
Yes, absolutely.
Yeah. And okay, Chelsea says, agree with Corey about the definition of physical safety. Scratches can be both a smaller incident or a larger, depending on how it's paired with other behaviors that signal action from a single event, or paired with escalating behaviors throughout the day. Yes, and I just want to remind folks that the other part of that definition of serious safety threat is things that cannot be resolved through their existing guidance and behavior policies. So it's kind of twofold. It's like physical safety, and then also that can't be resolved through routine measures. So there's two elements to it. And can DELC clarify expectations regarding confidentiality and information sharing when coordinating child-specific supports, including what information may be shared with whom? I'm concerned that without clear guidance, providers may unintentionally engage in inappropriate information sharing or privacy violations. And Katrina, I don't know if we have to answer that right now, but definitely take that feedback forward in regards to every ECB Connect as well. So what providers are sharing and are not sharing. Kira says timeline to return to care on the, let me get to 10. And then Chelsea says, agree with Rachel. I think that there needs to be some support and templating around what is required about the ECB process once the provider notifies ECB. Okay. All right. So we're down to the length of a temporary safety-based intervention may only be for the time necessary to incorporate supports to reduce the occurrence of behavior. The temporary safety-based intervention must end as soon as safety can be maintained with supports in place. The provider must document the basis for the duration of the temporary safety-based intervention. And then during the temporary safety-based intervention, this is where some of Kira's comments come into play. The provider must communicate with the family regarding any updates on access to supports, and then any changes in the child's behavior while they're not in care, and then a timeline to return to care. So communication is ongoing with the family while the temporary safety-based intervention is happening. So, and Kira's comments in here are the around 10C, which says the timeline to return to care on the basis of the supports and resources available, changes in behavior to the child, and considerations to physical and mental health and safety of others in the child care program. So just adding more around the timeline to returning to care and what might need to be in place. Okay. And then finally, if requested by CCLD, a provider must update CCLD if the expected duration of the temporary safety-based intervention changes. So this is just kind of keeping track of how long the child is not in care. Okay. We are down to 13 minutes. So I'm going to, this was a number change.
I do have a question,
Okay.
sorry, but it
Sure,
is in
no, go ahead.
regards to the registered family section or version of the suspension and expulsion program prevention ruling, and it includes, and I do apologize if you addressed this right off the bat and I just missed it, but it was number 12, which is not listed in the certified family version of the ruling.
No, thank you, Kara, for pointing this out. So 12 states in registered family, if applicable, prior to renewing the registered child care family license, the provider must have complied with the rule that requires them to contact every child belongs when a child is facing potential expulsion. This is only in registered family because the prevention bill and statute added this to statute. So in certified, it just says that they have to be, the rules must require compliance with contacting every child belongs. But in registered family, it is specifically tied to the renewal of the license. So this will be a discussion point at renewal for registered family providers.
So I'm wondering like why and in what scenario would this be applicable? And you're saying it's applicable directly and only in relation to licensing renewals.
Correct. This specific piece is only like
so then is that a requirement for a provider to reach out? Oh my gosh. See, I feel like there's information in there. Is it a requirement for you to reach out to ECB around your enrollment time, even if you don't have any, or I guess is it a requirement if you have current issues in your program that would require the support of ECB? I'm just trying to understand more
It
what really makes this applicable.
it consider it just a require like a any other rule. So essentially, if you have a child facing potential expulsion, you have to contact Every Child Belongs. And that at a renewal, it would just be something on your on the checklist that a licensing specialist goes through with you. They might state like, did you have any children that um, were facing expulsion, potential expulsion this year, or
Okay.
in the last 2 years? And did you contact Every Child Belongs?
Okay,
And the
that
answer
makes
could,
sense.
does that
Okay.
make sense? Yeah. So
Yeah, thank you for
it's
that clarification.
no problem. It exists in statute, and so that's why it's in rule for registered family. And it just reads slightly differently than the certified statute. So uh, I will say it's interesting. Like the subtle nuances of this law were interesting to review. But thank you for calling that out because it was something that I did not note in our agenda. So I appreciate, Kara, that you've thoroughly read through these. So the last, oh, go ahead. Yes, do we have more in the chat too?
Yeah, there was another comment in the chat around the requirements seeming likely to increase workload for licensors and generate additional demand for ECB services. Given that, I'm curious how fiscal impact was assessed and why no significant impact was identified. That was by Rachel.
So oh, sorry, workload on licensors. So the workload on licensing specialist is this just becomes another item that we are monitoring for and checking at renewal, and then is incorporated into existing licensing practices and things like that. It might be identified after implementation that it may increase workload, but it was not identified during our initial assessment. And then I can't speak to the generating additional demand for ECB services just because we haven't, I'm not tracking that. Katrina and her team are tracking that, and they're only in the, pilot and beginning stages of having access all around or across the state. So we don't actually know, or I can't speak to what the fiscal impact of this on ECB will be.
Kira gave a statement. I'm not sure what that was connected to. But
Just agreeing with Rachel Turner's point
Yeah.
that not sure how fiscal impact was assessed.
Thank you. And then Chelsea, excuse me, also put a comment in saying, I'm wondering the same as Rachel. We have 7 centers and have had the need to create support specialist positions just to manage caseloads within our system.
Okay. Right. We are at 7 minutes left. So we may end up going a little bit longer than we did, but like we did last week. So this last section in the childcare licensing facility rules is in regard to care of children with special needs. And this section has been significantly updated. So I did include a kind of there's some extra zeros in there. A version of this that does not include all the track changes. So essentially what this did was update when a plan of care is required for a specific child who is developing that plan of care. And then also removes all the elements of the plan of care as not all of those elements were relevant to all children. And so it now reads that when a qualified professional, and I will say that we received some feedback about how are we defining a qualified professional, and we are currently working on that draft language for what what could be considered or who could be considered a qualified professional. So when a qualified professional develops a written care plan for a child with a documented physical, developmental, behavioral, or emotional or medical condition requiring services beyond those typically needed by children of the same age, and the plan is provided to the provider with parental consent. Oh, this says the center. That should say the provider must implement the written care plan. So it defines who's creating it. It's given with parent consent. So those are two updates for this. And then the provider must implement the written care plan unless the plan requires the center, and I'm so sorry that we didn't get updates to that language, that should say the provider, to be out of compliance with the rules for certified family child care homes. A provider may apply for an exception to accommodate the needs of a specific child as outlined in section 0160. A really common, or not common, but an example of this is when an infant needs like a helmet or some sort of device while sleeping. Current licensing rules require nothing to be in the crib with an infant. But this is an exception to a medical condition that comes with documentation from the physician. And so those exceptions are reviewed on an individual basis. And then the provider must ensure that all caregivers that come in contact with the child are aware of and follow the written care plan. So, Kira.
So maybe this is written somewhere else, but I wanted to know how much time a provider has to enact the written care plan.
Their current rules do not state how long they have to implement a written care plan.
Okay. Okay, I feel like that should be stated somewhere. And then also how that again would correlate with ECB. And again, that's probably implementation questions, but if ECB is unable or other entities or programs are not able to provide supports to the provider, like, is it okay for the provider to say, hey, I'm not equipped to care for your child. It's not in the best interest of that child to be in my care. There's another service out there that is better suited to them. Is there any penalty for that, for making that statement and making it known that, hey, I'm not going to be best suited for your child?
That is a really good question, Kira. And this is also where that assessment may come in, like the rules we discussed earlier about, and that speak to reasonable accommodations and whether a program can make reasonable accommodations for a child.
And
Which
then,
would,
and then what is reasonable? That's
and
subjective.
that is something that DELC is not defining.
Okay.
Reasonable accommodations are something that is kind of outside of DELC's purview to define.
Okay. Okay.
So, but there are you're welcome.
Abby, I know we have to move these along.
So
there are
I know. Yeah. Always lots of, this is a really, I'm very, I feel very thankful that people are very passionate about this topic. And it is so important. And to have this level of engagement around it is appreciated. So curious what is expected of providers when implementing a written care plan, particularly if elements of the plan are not feasible in the family child care setting, especially for solo providers. Is there undue burden clause? We do not have an undue burden clause, Rachel, but I did kind of address that if it's not feasible in the child care setting. So that's when we would reference back to that earlier assessment. And when we talk about assessment, it may not be an assessment of the child. It may be of the assessment of the child within the care facility and assessment of the facility and the provider and the staff themselves. So it's kind of broader than just the an assessment of the child. Alicia says that I disagree with adding timelines since care plans can be very individual and a specific timeline may not fit that. And then also Chelsea says disagreeing with adding a timeline here. And Kira says that I strongly believe undue burden should be included within this. And then Rachel says in ADA, undue burden is defined as significantly difficult or expense or fundamental alteration of the program. So thanks, Rachel, for providing that definition. And we'll take that back to the group too. Provider mental and physical health should also be considered. Okay. Thank you. All right, we are at time and I apologize to Katrina again. We will stay on as long as we need to finish this. So if folks can, we appreciate you staying a little bit later so that Katrina can get some of your valuable feedback as well.
Thanks, Abby. And I'll echo what Abby said, that I really appreciate everyone's engagement on this and the passion for this. So this set of rules, up till now, we've been thinking about those licensing rules. And so now take that licensing hat off and put on the hat around services and supports and access to those. And the other thing I'll say is that in 2022, 4 years ago, we developed an initial set of rules and definitions related to what we then called the Suspension and Expulsion Prevention Program. And so what we have here that we're going to be looking at are revisions to those definitions that were developed at that time. And a few additions to the definitions. So the first one is number 2 that you see on your screen. And this is taking what we had previously was early childhood care and education provider and changing it to early childhood care and education program or early learning and care program. Early learning and care program is a term that is in common use on the programmatic side. And so we wanted to be able to use both terms to refer to this whole list of A through F types of programs that are serving children. So then B was also changed to provide a little bit of clarification. So previously it just said any program receiving state public funding for early childhood care and education services. And there are some programs that receive state funding, but they aren't programs where a child could be suspended or expelled from. And so that is the clarification that we added, is that it's when you receive public funding, where such funds are for the purposes of funding a young child's enrollment in a classroom or childcare setting. Oh, hold on a second. You know what? There is a different version that is not showing up on this page, which is it's saying any early learning and care services where such that a child could be expelled from. For some reason we didn't grab that, so I apologize for that. So any comments on this first change? Okay. So the next one is defining every child belongs. It is using the same or almost the same definition as what was used in the licensing definitions. It does refer specifically to the statute for House Bill 2166, which is ORS 329A.600. And then, Annalise, to your point earlier, much earlier, that we should define what Every Child Belongs Connect is. And we have done that here as an online access point for early learning and care programs to submit a request for support in maintaining a young child's enrollment in the child care program. Just pause for a moment, see if there's any comments before we go on. Kira?
Just more comments as to what is considered timely, and then guarantee that providers will receive support once they've requested services, because as other people have mentioned, we don't see that ECB has taken into consideration the capacity. Maybe they have, but at this point in time, it's, there's always possibility for wait lists, like how, what can be expected of us as a provider at that point.
Now remember, this is just defining the initiative. It's not talking
Okay.
about the implementation of services or capacity. It's just defining what are we talking about when we say every child belongs.
Oh, sorry. I thought at the start you said we could bring up issues with like service concerns.
Well, yes. And I mean, this is the section related to services as opposed to license.
Yeah.
But the focus is on the defining of these terms. And in this case, what is every child belongs?
Okay. All right.
Yeah, but thank you for your feedback. We've heard from you and this group as well as the previous group concerns about capacity and about timely.
Yeah. Okay, thank you.
Annalise?
Yeah, Katrina, thank you. My understanding from being on the advisory group for the last 3 or 4 years, however long I've been on there, is that the new rules only require the provider to contact Every Child Belongs Connects. It does not require anything beyond contacting them, getting that initial consultation. If there's a wait list, then the rules wouldn't it wouldn't prompt the rule citation, right?
Well, that goes back to the licensing rules. So
right.
So, yeah, that's
Annalise, she's correct that the rules only require that the program contact Every Child Belongs.
That's actually helpful. It helps it helps me wrap my head around this whole concept, knowing that. Thank you.
all right. So let's go on to expulsion. The change that is being made here is so that it uses the same definition as is being used in the licensing rules. We didn't want to have two different definitions going on. The same will be true for suspension when we get there. So I've noted your comments and questions related to that. We made a few small changes, technical changes to the definition of infant and early childhood mental health consultation, taking out the words training and coaching and using the word consultation there instead. And then planned transition. This is a new one. And so I'm going to go ahead and read it. Planned transition means the transition of a young child's enrollment from one early learning and care program to a different early learning and care program due to a young child's ability, specialized needs, or behavior. For a change of enrollment to be considered a planned transition, the plan must be developed collaboratively with the family, the staff of the early learning and care program, and a professional consultant or support specialist. Kira.
May I ask, like, why is this definition not included in the definitions under the other sections that we reviewed? Is it because it's specifically regarding a young child's enrollment? Like, is the planned transition only applicable to young children? And this is the section regarding young children?
Everything that we've reviewed tonight has to do with young children.
Okay, so
so
sorry.
the Abby, correct me if I misspeak, but the licensing rules are really focusing around what are the requirements in House Bill 2166 for providers to follow. And
Correct.
planned transition does not fall into that.
Okay, because it's not a required policy, basically, to follow. Okay, understood. Thank you.
But it is important as a concept around services and supports.
And Katrina, we have 2 questions in the chat so far.
All right. What role are ECBTA, ECMHC, or other consultants expected to play in planned transitions, and are they required participants in the process? And what if the family declines to participate in the planned transition? Yeah, families always have the right to decline, and we'll take that into consideration accordingly. I think every situation is different, so it's hard to make a comprehensive statement. In terms of ECBTA and mental health consultation, so we would see people in those roles as potentially filling this, what we're describing here as professional consultant or support specialist, in helping to define like what does it mean to plan a transition from the child for the child's enrollment from one place to the next. And Kira asks, will the ECBTA and other consultants provide triage for the provider? What do you mean by triage?
Will they direct us to who we need to speak to? Will they initiate contact for us, get us connected to who we need to speak to best,
Well,
provide the supports to our program?
so that's what happens when you contact ECB Connect. So when a provider contacts ECB Connect, they will be connected to someone who will then provide support around a
Gotcha.
situation.
Gotcha. Okay, thank you.
Uh-huh. Good question. Okay. So the definition of suspension is also being changed to match or be the same as the definition in licensing, with the exception that we have further defined suspension here. We've included a definition for in-program suspension and out-of-program suspension. And what you can see, I'll talk just a moment about those, but what you can see is we have also added this clause that we didn't have previously around that it is due to the child's ability, specialized needs, or behavior. So I think I'll just pause there and see if anybody has comments before. Alicia.
So I'm just gonna raise, was raised before, but I'm just gonna raise again that the suspension due to a child's ability, that term is really questionable around what we're referring to when it comes to ability. And again, is that development? Is that their ability to, I think in the last RAC, they were talking about potty training, but again, are we suspending a child because they're not potty trained? Like, so yeah, that term ability, I encourage us to find another way to, and I guess maybe I'm even asking, what are we referring to when we're talking about ability?
Mm-hmm. Yeah, thanks, Alicia. So I think the purpose of this definition is to define what falls within a suspension. So if a child is being asked to go home early or not come in the next day due to something about their, I'm going to say, ability or disability, or development or potty training, like there are many different things that fit into ability, that what we're saying is that would not be, that would fall into the definition of suspension.
Okay, so we're just, what you're highlighting is that if those, under any of those criteria, that would be considered a suspension. And
Yeah.
then
If a
therefore.
child's
the
at home
program-
because of that, it is
Okay.
considered a suspension. Yeah.
Okay, understood.
Yeah. I see Kira has another comment in the chat, requested additions for culturally responsive, trauma-informed infant and early childhood mental health consultants. So, Kira, are you suggesting adding culturally responsive and trauma-informed to the definition of infant and early childhood mental health consultant? Or different, or
No, thank you for asking for clarification. No, I'm asking if each of those phrases listed between commas, if those three phrases, if they could be defined in this list.
uh-huh. Okay. Thank you for that suggestion. Okay. So young child, again, here we had a previous definition and we are changing it so that it matches the definition being used in the licensing rules. All of the remaining changes from this point forward are simply to change, to add the wording of early learning and care program. And I think they weren't even highlighted. They're just administrative changes. Oh, and that top one, we changed early childhood suspension and expulsion prevention program to the name Every Child Belongs. Okay. Well, if there are aren't any other comments or questions, I will hand it back to Abby. Oh, Annalise.
Just real quick, I just think that tonight, the way that this went, I think underscores that we really need in the next advisory meeting, we really need to talk about how we're going to communicate and get more information out statewide, because I think it's pretty clear from tonight that most folks do not, unless they're in this whatever's the inner circle, whatever you want to call it, most folks do not really know what's happening, and we have not communicated this well enough as ECB, as Every Child Belongs.
Okay, thank you.
Okay, I just have one really quick slide for us on next steps. Tonight is not the only opportunity for you to provide feedback. So if you spend more time reviewing the rules and you have additional feedback, you can do so through the public comment period, which ends on May 15th. So there's almost 3 weeks left. And you can find how to do that on our rulemaking website. It can either be through an email, filling out an online smart sheet. We shared that a link earlier, but we will share it again. Also, you can attend the public hearing, which is hosted by Kathy on April 29th at 5 p.m. How to get access to that and join that is also on our website. The rules will be proposed and presented to the Early Learning Council on June 24th for adoption. And if they are adopted, the effective date of those rules would be in September of 2026. And then during that time over the summer, we will provide, we will update providers on via email and mail on the new rule text. And then we will also be looking to update any related technical assistance documents and forms, and then developing those resources that several of you have identified both in this meeting and the previous RAC meeting to support providers in implementation. I just want to thank you so much for spending your evening with us and staying on a little bit longer than planned. We so appreciate all of your thoughtful insight that you've provided to us. And yes, and again, feel free to use the other mechanisms to provide feedback. We review everything. And again, just thank you for what you do every day for children here in Oregon. And Kira, do you have?
Sorry, yeah. So just to be clear, so did you say at the start that we would continue to be kept in contact regarding any changes?
So we won't release the final changes until closer to adoption date, which will
Gotcha.
be there'll be an updated notice, which is the or it'll be in the Early Learning Council packet, right, Kathy? Like the finalized rule language will be in the packet, which won't be available until probably 10 days or so before the Early Learning Council meeting, so the beginning of June.
Okay. So,
The updates we were talking, I was kind of explaining what was happening with the Every Child Belongs Advisory Committee. So they are updated along the way, but
oh,
they
okay,
will be
okay.
updated. They will be updated at the same time frame as everyone else for finalized rule
Got
language.
it. Okay,
So
so there won't
I'm
be any other opportunity for like tonight where we could provide further rulemaking advisory comments.
So you can do that in via public comment. So, and it's
That's it.
treated the
Okay.
same as feedback given at the RAC. So
Got it. Okay.
we review it, and then we also provide a we are required to provide a summary of the feedback that we've received, both in the
Okay.
RAC and then in public
Okay.
comment, and then an agency response. So, and that'll be available on our website, like what we did with the feedback,
Got it.
essentially. And we will also be presenting the Early Learning Council with that same information so that they can see what we heard and then what we did. So,
Okay. And
yeah.
will we have access to all of that as well? Just like as
Yes.
notes on tonight's conversation?
We don't post the notes, but will post like we said, a summary of the feedback and then the agency
Got it.
response, and that will be on our website. Yes. It
Okay.
probably won't be for a
Okay.
bit because we've got a lot to go through because we
Yeah.
had a lot of feedback, which is great. It's what we want.
Okay.
But
Thank you.
it will be available on the the DELC rulemaking website. And then again, if you want to watch the Early Learning Council meeting in June, there are ways to access that too on our website,
Got it.
it's in the chat. You can also sign up. I think if you've signed up for the Gov Delivery, you'll get all of that information as well, or the childcare updates is another way to get up-to-date information from DELC. And then Annalise, I see your
Okay, thank
hand up
you.
too.
Yeah.
You're welcome.
Okay, so I'll just help you, Abby. I'll help Delk out for just a second. For those family childcare providers who want more information, want to re-engage on these rules, want to get information to Delk, want to do whatever, all you need to do is reach out to your union because we can continue the conversation with Delk and we can help you get this information. You just got to reach out to your union. All right. Or to me. So.
All right. And with that, I'm going to thank everybody for joining us and take care of yourselves and have a wonderful evening.